Hi, everyone. I'm Patricia Delgado, nurse practitioner and your host of the Skin Psych Podcast. I'm certified in primary care, dermatology, and psychiatry, and this is where those worlds come together. The Skin Psych Podcast video series is where we're going to dive into the powerful relationship between the mind and the skin, why it matters, and how understanding it can transform patient care in both dermatology and psychiatry. Today, I have the absolute pleasure of welcoming someone who is not only an exceptional dermatology PA, educator, and speaker, but also a dear friend and APP supporter. Shanna Miranti, PAC, has been a leader in dermatology for more than 2 decades. She's known for her compassionate patient care, her depth of clinical expertise, and her ability to break down complex topics into practical, real world clinical pearls for our clinicians. She's contributed extensively to our field through her writing, lectures, and her mentorship, and she brings both heart and skill to everything she does. I'm thrilled to have her here today to share her insights and her journey with all of you. Shanna, welcome to the very first episode of the Skin and Psych podcast video series.
Patricia, thank you so much. This is such an incredible honor. Not only am I so incredibly honored to be here, but I'm also such a fan of you and just your passion for education in the APP space and in derm specifically, and just love that you bring this new look to our field and something that's so incredibly important. I'm just so happy to be here. So thank you again.
You're very welcome. You were the first one that came to my mind.
Oh,
So, without further ado, let's get started on some of
yeah,
these
let's dive
questions.
in. I'm ready.
Yes. So I always like to know what originally drew you into dermatology and what's kept you passionate about it all these years?
It's such a fun question. Both of my parents are podiatrists, so I grew up working in their offices and sweeping up toenails and putting on bandages on really bad boo-boos and knowing that I definitely had such a love of the care that they had for their patients and the compassion that they had for their patients. But I was always drawn to the rest of the body. Like, Dad, what's that growing out of that guy's head? And what is that out of that woman's arm? And why is she so bruised? And what's going on with her skin? I was always fascinated by the skin. And, my father was always trying to like focus on the lower extremity, like she had to focus on the feet, and I just couldn't. So I knew I had this love of medicine. I had this love of being a potential caregiver and saw my parents as such incredible role models. But I just wanted to find out more about this fascinating organ. So in PA school, did a couple of rotations, and I was certainly hooked. I was a kid that had acne and struggled with a lot of dermatologic conditions as a child and as a teenager. So it became very personal, when I started
Mhm.
treating these patients and helping people with their skin conditions. And I loved that I could make a difference. I loved that it was something tangible and for some reason it made sense. I loved the visual aspect of
Mhm.
dermatology. So there's so many things about derm that I was originally drawn to. What's kept me so passionate, 23 plus years later, is the fact that it's ever evolving, ever changing. I
Mhm.
never go a day without learning. I think that's so critical that we all stay on top of our fields. So I just continue to be in awe of this amazing organ. And we have so many amazing therapeutic options for our patients these days. So I could go on and on. This is just
Yeah.
question one, but
There's so
but it,
many.
it is just such a great field, and it's so
Mhm.
exciting to be able to practice dermatology.
Definitely. Yeah. So many therapeutic options and then so many more coming.
Right.
It's like just when you feel like you've gotten a hang of all the ones that are there, and then it's like there's some more coming. Oh, yep.
I
Got to keep
know. And
learning.
we have
Always
to
got to
keep
keep
up.
learning.
Keep up or
Mhm.
you get left behind for sure.
Yeah. Yeah. And you have some family members that are also in healthcare, right? Your
I do.
brother,
Yeah.
Corey.
Correct. So my brother Rory is a dermatology PA, and he actually is in my practice, and he's wonderful, and he's a surgical PA and is
Mhm.
so fantastic at what he does. My sister-in-law is a dermatology PA, and she is also in Florida. And then my sister is a podiatric surgeon. She's actually a podiatrist. So both of my parents are podiatrists, my sister's a podiatrist, and I have two derm PAs in the family. We also have a lawyer who's the black sheep of the family, but he at least married well. He married a derm PA, so we allow
Oh,
him
that's so
to
cool.
stay in the family.
Yeah. I mean, you got to have a lawyer in the family. I mean, I feel like that's pretty helpful, you know?
For
You
sure.
got to have
Yeah.
someone ask the law questions, everybody else for the medical questions, and then that one person for all the law questions.
Yeah, he's pretty
I love
amazing.
that.
He reviews all of our contracts, tells us, everything that we should be careful about and everything that we are doing right and doing wrong.
That's awesome. So, was there a moment early in your career that shaped how you approach patient care today? Like anything specific, like a specific patient story, maybe when you were in PA school or fresh out of school?
So I've always been drawn to acne and rosacea, being kind of a sufferer of that condition as a not only just teenager but as an adult. And it's one of those moments that humbles you when you are the clinician and being called out by a patient about how your skin
Mm.
looks. So I had a very, very, very humbling moment early in my career when I was trying so desperately to get pregnant. And now, as you know, I have four beautiful children, and we're so incredibly blessed, and our cup literally overflows. Sometimes a little too much because it's a
Oh.
little bit chaotic, but early on we struggled to get pregnant. So I had to go through a lot of fertility treatments. And as you know, hormonal treatments will cause all kinds of problems with the skin and truly wreak havoc on the skin. So my imposter syndrome moment was being called out by a
Mm.
snarky teenage patient, whose mom was, kind of fussing at her for not paying attention to my instructions. And I was trying to counsel her on her acne. And she said, Mom, why would I listen to her? Look at her skin. It's worse than mine. And it was,
Wow.
it was something that, became such a core, moment in my career where I realized that, that these patients are hurting so badly and they're so vulnerable, and yet they
Mhm.
lash out. And
Mhm.
and that, we all have to take a moment to be humble and say, hey, we're all human beings, we're all patients here. I'm struggling with my stuff, you're struggling with your stuff, and
Mhm.
we really shouldn't be hurtful to each other.
Mhm.
So that was really kind of like that was something that took my career, on a different trajectory, because I could have like crumbled and started crying and getting so upset and my biggest vulnerability. But it really was a moment that made me see that I have this ability to empathize with my patients,
Mhm.
and I can say, "Hey, I've been there, and I've sat in this hurt with you, and just as you're
Mhm.
feeling now, I know what you're feeling." And it really opened my mind to empathy, not just sympathy, but true empathy. And even when I'm counseling a patient that there's a condition that I have know nothing about,
Mhm.
I at least can tell them I've had my own struggles, and although they're very different than yours, and I don't ever want to put myself in your particular shoes and in your situation, I know what hurt feels like, and I know what vulnerability feels like, and we all
Mhm.
have those, we all have those in our life, and I think that if you can take off the clinician mask and be a
Mhm.
human being and be a kind person and listen and be able to connect at the human level with a patient, you will earn their trust for life. So I saw my parents do that. I saw my
Mhm.
grandparents who were providers in healthcare do that. And I just was always just in awe of that ability to make connections and ability to kind of transcend this space between provider and patient, and that's really what keeps me going and keeps me inspired and keeps driving me to be the best PA that I can.
Yeah, that's really powerful, especially in that situation where not like it was not just human connection. It was more like you were able to pause and see that what she was saying to you or that reaction she was having was coming from the pain of
Oh
her
yeah.
physical skin disease, of
Oh
her
yeah.
acne.
Oh, for sure.
It had
Now
nothing to
and
do
now
with
I
you.
have teenagers, so now I can counsel
Yeah.
my own teenagers, hey, don't be that teenager.
Yeah. Yeah.
Everybody has struggles and
Hmm.
we are not here to judge, we're not here to judge
Right.
others and their
Yeah.
situation and their lot in life. We're here to help and whatever we can do to help that day, that week, that year, that decade, whatever we can do, we have the obligation to try.
Yeah. So I gotta ask, how did you respond to that?
It's always tough when you feel like you've been sucker punched and you're, trying to keep your professional self together and not cry, right?
Mhm.
So it was, a really kind of like hard swallow. And I said, you know what? You're right. Like my skin is terrible right now. And it's because I'm on all these fertility medications to try, for my own health. And I don't even know if I went into it.
Mhm.
But I said, but that's my stuff and I'm working on it. And I
Mhm.
really want to help you. And this is about you. And let's, and I tried to redirect without
Yeah.
bursting into tears and crying, but,
Mhm.
and I think I probably made some kind of, a smart ass comment about, hey, well, at least you can use these great medicines that I can't use right now because I'm trying to get pregnant.
That's what you said in your
wish
head,
I
right?
I wish I could use these great medications that I'm offering to you, and I hope you will use them because I hope you
Mhm.
can take this and go in the right direction.
Hmm. That's awesome. That's really good. That
Yeah.
takes a lot of strength and courage to sort of just, this is what
You
I'm
know,
going through very briefly, and then redirect.
it's tough early in your career, I think, to be brave and to have real conversations because I think so many young providers are so scared to look unprofessional or they are stuck in that imposter syndrome where they feel
Mhm.
like they don't know it all and they're terrified that they're going to get asked a question that they're not sure of the answer to. I think, 25 years in, if someone now made a backhanded comment about my rosacea or something, I'd say, yeah, I need to get a little more laser. Like, let's go do this together
Yeah,
or
let's go.
something.
Yeah, you want to take me? Let's go.
Yeah, for sure, for sure. But
Yeah.
it's all about, again, bringing it back to basics and
Hmm.
being a human being and kind of figuring out, what's right for that patient
Hmm.
and not making
Definitely.
it about me, making it about
Right.
them.
Yep. And it's interesting that you mentioned the imposter syndrome because I feel like when we all get out of our NP or PA programs, it's like, okay, now I'm a clinician,
Right.
and it's a journey kind of finding that balance of being human and also the clinician and then blending it together because at the end of the day, we are all human.
For
So,
sure.
and that's such an important aspect of the caring relationship with the patients.
Yeah, for
So,
sure.
yeah, yeah. So, when did you first start noticing the psychological component in your dermatology practice or in your patients?
Very early. So I'm very, I tend to be one that is very good at observation. I've always been the one that could, find where was Waldo in the paper very quickly. I
Yeah.
can observe people's just their mannerisms and their
Mhm.
attitudes and you can, once you've been in this field long enough, you can see whether it's coming from a place of confidence, a place of pain, a
Mhm.
place of vulnerability, or just a place of negativity. And some people, although I walk in with a big, huge smile on my face and I'm this bundle of like, bright, shiny energy, I think I probably turn some of those negative people off because they're like, okay, she is way too much for me. She is way too happy. She is way too smiley. But I think it's interesting, now seeing my career 20 plus years in reverse, you end up attracting positivity. When you're in a good space, when you're happy, when you love what you do, you attract positive people, and positive people will want to come see you. They will want to wait 3 months to come see you. The disgruntled, mad, old, kind of curmudgeon is not going to wait 3 months. And if he does, he's certainly going to curse you out, the second you walk in the room. And when you meet that with a big, huge smile and say, "Oh, I'm so sorry, I couldn't help you, I couldn't help make, turn that frown upside down." And when I can't redirect in that way, they may choose to not come back and see me.
Mhm.
But I think that, finding that connection between what's going on in the inside and what's going on the outside is so critical. And a lot of
Mhm.
young providers, it's not, they're so, I feel like young providers are so concerned about as we all should be, the overload of information that we have to learn, that they don't stop to take a moment, sit down, listen to the patient, truly hear not only the words that they're saying, but the concern behind those words, or the backstory behind those words, or what they're really nervous or worried about. Because sometimes if you can hear the fear in their voice, if you understand that, what's going on in their life, and have your MAs ask some intuitive questions, you can really get to the heart of the issue pretty
Mhm.
quickly and understand where they're coming from. And then that helps you create a really empowered, patient provider bond that then can help drive better patient care, in my mind, because you can have that shared decision making where the patient trusts you, and that you're kind of truly going in the best direction for that patient.
hmm Definitely. I love what you say about not just hearing the words that patients say, but also their body language and just like the
Sure.
slight shifts in the tone of voice
Totally.
and sort of bringing ourselves to, connect with that part of the patient. There's a psych term called attunement, which is when you sort of like get on the level of the person that you're
Yeah.
with and really creating a container for them to
Yeah.
feel like it is a safe space to talk about those things that may be in there, that you can
Yeah.
sense it's there. Um,
I love
like,
that, because I find that so important. I see a lot of peds and I see a lot of kids.
mhm,
And I think a lot of providers are terrified by children, or they're terrified that these are not just mini adults. And oh gosh, I don't know what age indications these
mhm,
medications have. And I don't want to deal with the kids, and I don't want to deal with the parents. But I am a very different provider when I walk in the room with a stern, kind of grouchy guy, or a,
mhm,
professional female who is just like so posh and so perfectly poised,
mhm,
or a kid who's literally like playing with their little trucks on the ground. Like, I get
mhm,
down. I'm giant. I'm 6'1", so I am terrifying when I walk in the room until I get down to their level. And I sit down crisscross applesauce on the floor with them, or I'll get as tiny as possible, and like you said, kind of come to their level and listen, and kind of match their energy a little bit, or match their tone of voice. Sometimes I can be a little too loud, or a little too boisterous, or a little, too much for some patients. So sometimes it is important to learn, and that takes practice.
mhm,
That takes years of observing them walk down the hallway, like kind of having an ear to the door and listening to how they're treating your MAs, and
mhm,
listening if the kids are crying, or if they're excited, or they're happy, or whatever. And you have to kind of match that energy. So for anyone who sees kids, for anyone who sees peds, that's so critical to good patient care, because you immediately get that parent buy-in if the kid
mhm.
likes you and accepts you when you walk in that room.
Yeah, definitely. So true with kids and even the adults though. You're so right about that when you walk in and a very stern man or the posh woman or, someone that seems really shy or someone that's very outgoing.
Yeah,
Those are the really fun ones because you just let her rip, but you kind of
exactly.
just sort of match. And it's not necessarily about changing who you are either. You're still
Not
the
at
same
all.
person, the same kindness, the same respect, the same level of how much education you're going to provide, but it's how you communicate that and how you express it.
Absolutely. And the
Yeah.
delivery is everything, because if you
Hmm.
don't deliver it in the way that they're ready to receive it, then they may
Hmm.
completely miss the message.
Big time. And I feel like this is so like parallel to communication in business, communication in like personal relationships. In business, they have like the DISC assessments, to find out what kind of personality you have.
Right?
And then it's like based on your personality. And then you'll have these like, leadership coaches or executive coaches, and they'll coach your team on, okay, so this person's like a high D and this person's the S and C. So when they communicate this way, what they're really trying to say is this. And I think that's important for also not taking things personally.
For sure.
So in
For
the
sure.
in the exam room, we'll say, maybe a person reacts a certain way, but it's not anything personal. Like, for
Right.
example, that teenager, it's like sometimes it's just pain. It can be
Oh, yeah.
trauma. Maybe they had a bad
Absolutely.
day. Yep.
Absolutely. Yeah.
Hmm. Or they just like things, like short and sweet. Like, give me the
Yep.
education how it is, or yeah.
Exactly.
Hmm. So, in your experience, what aspects of skin disease take the biggest psychological toll on your patients?
Oh, that's such a good question. Because I think that, we learn in school about the big scary stuff, the heavy stuff, the melanomas and Merkel cell and very, life-threatening conditions. And there's not many of them in dermatology, right? So we are very blessed in this space that we don't have to deliver bad news very often.
Mhm.
And when we do, it probably strikes us just as hard as that patient. And we feel that for them, and we want to get them the best care. But oftentimes I feel the psychological burden of chronic inflammatory skin diseases can be harder to help a patient through than a skin cancer diagnosis sometimes. Because at least with cancers, okay, we've got a plan. We're going to cut it out. We've got like it's very surgical, right? It becomes very much like, okay, we're doing this, we're doing this, we're doing this, and you are, 99% of the time will be fine. Or if you are not, if this is a really bad melanoma, we are going to get you to the absolute best oncology center. We are going to do the gene expression profiling testing to find out exactly how aggressive this tumor biology is. We're going to do this, we're going to do this, we become this like this robot that tells them everything that they need, and it feels like, we're doing everything we can. Um, with psoriasis, with atopic dermatitis, with acne, with rosacea, with so many chronic inflammatory diseases of the skin, there's not always an endpoint, right? There's not always a finish line. And we can't tell patients, when they'll be able to stop these medicines. We're going to set them up with the best care that we can, but we can't predict the trajectory of their disease. And that's terrifying for a lot of patients that in 2025, we still can't say exactly when, where this is going to go and exactly how long they have to be on this medicine. And so that I think sometimes takes more of an emotional toll on patients, and specifically, younger patients. I feel like that have their whole life ahead of them. They're like, what do you mean I have to deal with this forever? Um, but it's so interesting that what we learn in school as the things that should be the heaviest, or should carry the most weight, and certainly not. I'm not, diminutizing the pain that anyone feels from a cancer diagnosis, because that's tragic and terrifying and can be very traumatic. But I find that, patients, which was surprising to me, patients can be just as terrified and just as nervous about a chronic inflammatory condition, or they're very flippant about it and then they're mad when it doesn't go away. They're
Mhm.
frustrated, and that has a whole psychology to it, because the frustration of not being able to cure an inflammatory disease can have its own trajectory for sure too.
Hmm. Yep. Yeah, just the idea that so this is going to go on forever, or so how long do I have to take this
Right.
medication?
Right. Don't you find it interesting that the second question out of like, okay, well, how do we treat this is, okay,
Mhm.
well, when can I stop?
Mhm. Yeah.
We haven't even gotten to step three, of the,
Yeah.
oh, okay, we're going to do this and we're going to do this. And okay, but how long do I have to be on that medicine?
Mhm.
And my answer is often, well, it depends. It depends on how your skin
Hmm.
responds. It depends
Yep.
on how things go. And that's a
Hmm.
little scary for patients who want a definitive answer. They're coming to us for answers and they want to know, well, the cure. Like, when am I going to be done with this? When am I going to be cured? And it's not always that simple,
Right. Yeah. That's always a tough one to answer because it's like, well, it depends, That's
right?
the old lawyer answer. It depends. Yeah.
I always love to use a lot of like metaphors and a lot of things. Like,
Hmm.
I will often try to put it into context or put it into a different disease state that they're already familiar with,
Hmm.
So I see that you're also on blood pressure medication. Okay, so you have high blood pressure? Yeah. Okay, well, how's your blood pressure doing now? Okay, it's great. Why? Because I'm on medication. Okay, well, what happens if you stop that medication?
Hmm.
Oh, okay. So they understand the chronicity of like certain like cardiac diseases, but it's
Hmm.
like, when it comes to the skin, I
Yeah.
feel like they want to just be like, okay, I'm done with this. I'm ready to be done. I'm ready to quit.
And what's interesting with that though is even with certain like if it's early hypertension, secondary to obesity and a couple other lifestyle factors, even like I've seen patients come off of their blood pressure medications when they're
Sure.
on that cusp. So even then it's like, but that is a good analogy, especially for patients that it's they're a little bit older and it's
Yeah.
just part of their regimen and it's been a part of their regimen for a long time. That is a good analogy. I like to use the analogy when it comes to aesthetics, because a very common question is, well, how long will the results last? And I
Mm,
say, well, so, I feel like doing treatments for your skin is kind of like going to the gym. You don't just go one time and it's like, oh, okay, I did this for my muscles this one time and that's it. You kind of
right.
go for maintenance and then as you get older, you actually have to be working on your fitness a little more and be more proactive about it because we are aging and our bodies are actively aging. So, same thing with our skincare. It's like our skin is aging and changing as we get older more and more. So, we may have to do things a little more frequently, a little more often,
Yeah,
and have a good skincare regimen. But yeah, no, I,
yeah,
I love the analogies. It really helps people like understand better
for sure. I
with
love
that.
those workout analogies. I use those for
Mhm.
a lot of different conditions as well.
Yeah. So, what tools do you use or wish you had to help patients better regulate stress around their skin conditions?
Uh, I wish we had more time, right? I wish we had more time in an exam room. I wish we had more time
Mhm.
on this podcast to be able to go through it all. But I feel like if we all had the time, energy, and empathy to sit and
Mhm.
counsel and talk them through sleep hygiene and how important gut health is and how important it is to live like a less inflammatory lifestyle. There's so much that we now know, about, all of the homeopathic and more just kind of lifestyle functional medicine recommendations that can help so many chronic inflammatory conditions, including skin conditions. But we just don't always have the time to be able to go through all of that with them, in addition to
Mhm.
trying to come up with a good plan and, also see 40 patients a day and also fill out their prior authorizations and get to all of the mountain of things that we need to do. So time is such a luxury, but I wish more clinicians had education on a lot of the homeopathic ways or functional medicine ways of looking at inflammation specifically, because there's so much that can
Mhm.
help our patients and so much that we can help counsel patients on. Of course, you can only lead a horse to water, you can't make them drink, but um, if we had the time to counsel patients appropriately and had good resources for a lot of those things. And of course, I send patients to websites, I give them handouts, I do all of the things that we should all do, but yet, I'm not their
Mhm.
dietitian. I can't go home with them and clean out their fridge. I can't do all the
Yeah.
things that they probably need.
Mhm.
So maybe someday when robots are running our home and our lives, they'll help.
I
They'll
mean,
help with
they could
that.
at least print out the handouts as we're talking. I
That would
think
be
that would be
great. I
beneficial.
mean, please, yes, that would be
Mhm.
wonderful.
Yes, definitely. Yeah. Um, Yeah, it's hard when you have such short amounts of time, and I love that in dermatology journals and I'm seeing it more and more. People are talking and writing about the actual evidence and the science
Yeah.
behind that connection. Because, some people are like, oh, it's woo woo, somatic therapies or this or that or stress relief and your physical health, but it is not. Well,
Yeah,
if woo woo equals science, then yes, but there it's real. I mean, we can even see it when we're stressed out and our face turns red
for
or
sure.
we sweat more in certain areas of our body, and we already knew about the HPA axis, and now there's the NICE network. So I hopefully now we can all feel more empowered to bring that science in a very basic form to our patients, because I feel like that's also really validating for them. Like,
For
oh,
sure.
okay, this isn't just all in my head.
No, I think it's such an important part of patient education is to help them understand their condition and understand what they're
Mhm.
going through. And again, have that human compassionate moment where you say like, "Oh, I bet when when you have hyperhidrosis, I bet when you get nervous, you sweat even more and you even sweat in a cold room and you can't control it." And they're like, "You're right, I can't control it." And
Mhm.
so assign like helping kind of them get rid of that blame sometimes is very
Mhm.
helpful
Mhm.
for any condition, especially again in the inflammatory world. Patients always want to know, well, what did I do to deserve this? Like, why do I have this? Why is this reacting this way? And just kind of like helping relieve them of the blame and then assigning some scientific meaning to what they're experiencing and why they're experiencing it. The hormonal fluctuations of acne. It's amazing when I explain to females like this is why your acne flares at this particular time in your cycle, and this is what your hormones are doing. It's like I've explained, quantum physics or something. It's it's mind-blowing to some people,
Yeah.
but we have to remember that not everyone is medically trained, not everyone understands the
Mhm.
science behind everything. So when you can explain things in a way that makes sense in the patient's language and it helps them understand their own condition better, it's so critical to help them find a way, to help treat their conditions in a better way.
Yeah, definitely. It gives them that extra motivation too. And they
For
feel more
sure.
empowered, I think, as well.
Yeah, for sure.
So, just a couple of fun questions as we start to wrap up here. If you weren't working in dermatology, what other healing or creative profession would you see yourself in?
Oh man, that is a tough one because I am the mother of four, and my mother, who I'm also the oldest of four, so I was always kind of the big sister, bossy pants, Pied Piper. Just ask my younger siblings. I would just always kind of take them along for the ride, but I always feel like I was drawn to healthcare because I always wanted to help and always wanted to, be the person that could provide relief for people. But I wanted to be, the everything we went to, the pediatrician, the OBGYN, the baby nurse, because they got to hold the babies. I wanted to be, a singer, actor, dancer. I wanted to be like all of the things when I was a little kid. So if you take your
Wow.
like your ballerina, your teacher, your every single profession, I don't know what that magic profession is, but I still want to do all those things. And it's
Yeah.
crazy at almost 50, I don't know what I want to be when I grow up because I feel like we are all capable of so much and
Mhm.
there's so much yet to be done and so much more that I want to do, but I want to, truly be, inspiration for my kiddos. I hope that, I can inspire my kids like my parents inspired me. And maybe not in healthcare, if they want to go into construction or if they want to be a tuba player, whatever it is,
Mhm.
whatever in the
Yeah.
world they want to do, I want to be their biggest cheerleader and I want to be able to kind of help nurture, their professions and their careers. But I still don't know yet. Ask me in 5 or 10 years and I probably still
Okay.
won't have an answer.
Maybe you'll just be a dermatology PA that also does ballet
Yeah, maybe so. I'm really good at
or plays the
juggling, I
tuba.
found. Like I juggle a lot of things, career, life,
There
work,
you go.
kids,
There you
blah,
go.
blah, blah,
Yeah.
blah, blah. So I'm just getting better at juggling. So maybe I'll be a circus performer. You never
There
know.
you go. Yeah, that would be a really interesting circus act. Here comes Shanna Miranti
I
juggling,
know.
and it's just
Juggling
you.
knives and four children and career.
Okay, and then
Watch out for sharp objects.
yes, what's the funniest thing a patient has ever used? Yeah, funniest or unexpected that a patient has ever used before coming to see you.
Ooh, like as a therapy?
Hmm.
Oh gosh, that
Or
list
the
is so
funniest thing you've
long.
ever seen, or like, for example, for me, the funniest thing I ever saw was a patient put on her paperwork that she was allergic to ghosts.
Oh, interesting. That's funny. That
I
is
was like,
that's
oh.
very clever.
Hmm.
Wow, that's a good question. You feel like you've heard it all and seen it
Mhm.
all. Um, I always joke, like patients are always like, "Oh, I'm so embarrassed. I didn't wear this, or I wore this, or I
Mhm.
didn't." They're like, they think I'm going to tell their mom that they didn't wear their best
Mhm.
underwear to the visit today or something. And I always say, like, I am literally never surprised by what people are wearing when they
Mhm.
walk in the room. They can be completely naked, like, lean back, like in the chair,
Mhm.
and just having a great day. And it doesn't faze me. And I think some people want it to phase, the provider that's walking in, and I just kind of walk in and do my thing and meet them
Mhm.
at their level. If you're going to try to be a jokester, then I'm going to be a jokester back, you know?
Mhm. Right, exactly. If they're making a
But
joke about it, then, yeah.
correct. They're obviously secure enough or insecure
Yeah.
enough to be able to handle a little bit of a give and take.
Yeah.
Sometimes it's more, the things that people say and do but no, I think, one of the funniest things paperwork wise, we used to have on our paperwork, like, how many alcoholic beverages do you drink? Yeah, if
Mhm.
yes, how many alcoholic beverages? Do you smoke? If yes, when? So it
Yeah.
was like a teenager, and this was before any marijuana was legal in any state, anywhere. And
Mhm.
it was like, do you do drugs? And he was like 16, and it was like, check yes, and it was like, what? And he said marijuana, and he said, but I quit yesterday. I was like, well, that's a lie, but thank you for
Mhm.
sharing.
Yeah. Good job. All right. One
No,
day.
I know, exactly. But it was, you never
Yeah.
know what paperwork can be really funny. Sometimes,
Mhm.
like, now that we make them fill out 100 papers, like, definitely encourage providers to read them because sometimes patients will just get so sick of the paperwork. So by like the
Mhm.
third, MIPS form that they're filling out, they really will fill out like if they're clever or if they're
Mhm.
frustrated, they'll fill out like really funny stuff or
Oh.
that this senator or politician is their next of
Mhm.
kin, and you should call them for HIPAA and
Oh
all
my
this stuff.
gosh,
So
that's
pay
funny.
attention. Make sure you don't glaze over that.
Yeah, might want to clarify that one.
Make sure you're actually paying attention to that.
That is funny. Well, thank you so much, Shanna, for being on the first episode of the Skin and Psych podcast.
Yes. It was truly my honor. It's been such a joy to speak with you and to get to know you. And I hope you don't hear my four children running around making loud noises in the background, but I
Not at all.
appreciate.
You have a great mic.
Oh,
That's
yes.
awesome. Yeah.
Yes. It's all about the
And
good
this was
mic.
absolutely
Yeah.
fantastic. I learned so much more about you, and you're
Yay.
even more inspirational to me now. So,
You're so sweet. Well, I am so excited to see where this podcast slash video series is going to go. I know you're going to have some fantastic guests, so I cannot wait to follow along and to see what you do with this because I think there's such a need for this education and there's such a need for inspiration, kind of in this subject and derms need to learn more about the psyche of their patients and need to care more
yeah.
about the psychologic, condition and where that patient is at during that visit because that will change the trajectory of their entire, disease potentially. If we can meet
Mhm.
them at their level, if we can help them feel less vulnerable and feel more cared for, we know that that shared decision making will end up, with better outcomes.
Yeah, absolutely. We can turn our presence in the exam room into part of the medicine.
Yeah. Yeah, I
Yeah.
love that. I loved your lecture at Elevate Derm 2025. You did such a great job kind of bringing dermatology and psych together and helping dermatology clinicians figure out that, that it's not just, about the medicine of dermatology. You also have
Mhm.
to have that the psych component. You need to come to the table with that trauma-informed care plan. That was mind-blowing, and I'm so glad that you brought that to light and
Thank
taught so many
you.
of us about that.
Thank you, Shanna. Where can people find you, learn from you, or follow your work?
Well, you are welcome to come to my clinic in Naples, Florida.
Or have an
I
appointment with
am I'm my best self in person. I always say that. I am, I was so anti-social media for 20 plus years and I always said I don't have time for it and if I can't do it well, I'm not going to do it at all.
you.
And then I had a PA student who finally convinced me. I've had multiple MAs and all these 20 something MAs who've tried to convince me to do social media over years, and I was very anti. And she said, if you don't put all of the things that you do out there, my entire generation, will not learn about it and will not ever see it. And it was kind of a sobering moment, like, wow, like this is how this generation learns, and everybody wants to hear little snippets and podcasts and wants to be spoon fed as we all do. We want to be spoon fed the best information in the shortest amount of time possible. So I am on Instagram. It's at Tall Girl Derm PA. So I welcome anyone. I do try to, keep it fun and keep it lively and help with the education pieces wherever I can. I try to center it around whatever month it is. If it's this, awareness month, I will, try to focus most of my education on that disease state for the month. I'm also the co-host of the Skin Sync podcast with my fantastic co-host, Bucci Nita, who is a PA out of Atlanta, Georgia. And this is sponsored by the Elevate Derm Alliance. And we have been so fortunate to have amazing guests and amazing topics. And we've been able to connect in a very cool way. I love the podcast format. I love the fact that we're able to two derm PAs that are busy and practicing and we're able to come together and really learn from each other. And we love those short snippets of information.
Mhm.
And then I also am on faculty at Diversity in Dermatology, so absolutely love that organization and love everything that Diversity in Dermatology is doing for the betterment of the education of dermatology providers. So I, like you, am at conferences, so please come up and introduce yourself if you're ever at a conference. I stand out. Like I said, I'm a giant. I am the tall girl derm PA. So find the tallest girl in the room, and that's probably me. And please come say hi.
Thank you so much, Shanna. Thank you, everyone, for tuning in to the first episode of the Skin and Psych podcast video series, where we bridge dermatology and mental health one conversation at a time.